So emergency contraception, also called as postcoital contraception or morning after pills, is used in an emergency situation. So it is used after intercourse before the time of implantation. It's said that the name emergency contraception should not be used. The term interception rather than contraception should be used for this method. So this prevents pregnancy and does not interrupt previously established pregnancy, and it is not an abortifacient also. Emergency contraception is not a good option for providing long-term contraception and this does not protect against STIs. So mechanism of action of emergency contraception, actual mechanism is still not been established. It may act by inhibiting ovulation, preventing implantation, or preventing fertilization. And as I said earlier, it does not interrupt already established pregnancy or cause abortion. So what are the indications of emergency contraception? So unprotected sexual intercourse within 72 hours, failure of practicing contraception like condom break or slipped condom, or pills are missed, its IV is expelled, or a woman is late for the DMPA or by more than 2 weeks. It can also be used, or rather it is used in cases of rape, sexual violence and incest, and used in women exposed to possible teratogen, for example live vaccine, cytotoxic drugs, etc. So emergency contraception should be used only rarely in cases of emergency only. It should not be used repeatedly also in one menstrual cycle, as they are less effective. Efficacy is about 80% as compared to the regular methods of contraception, which are more than 99% effective, and emergency contraceptive pills have more side effects. So what are the methods by which this postcoital contraception can be used? In 1970s, there was a USP method which was used, in which 2 overall tablets were used as early as possible after coitus and repeated after 12 hours. That is ethinyl estradiol 0.1 milligram with levonorgestrel 1 milligram within 72 hours and repeated after 12 hours. Since the dose of estrogen and progesterone was quite high in these tablets, the side effects of nausea and vomiting were quite prominent. Nowadays, mostly levonorgestrel is used. It can be used as a 75 microgram tablet taken as early as possible after intercourse, but within 72 hours. Then 1 tablet is repeated after 12 hours. Another way is take 2 tablets or 1.5 milligrams single tablet as early as possible. So usually nowadays it is a 1.5 milligram single tablet is taken. Mifepristone, which is RU486 and anti-progesterone, 10 mg single dose also can be used as an emergency contraception. Side effects of postcoital pill, nausea and vomiting. Nowadays it's not that much because the dose of progesterone is quite low, but it used to be very common during USP regimen. But if one has taken the tablet and if she vomits within 1 or 2 hours after taking the tablet, then it will not be effective. More than 2 hours have elapsed, then it will be effective. The other side effects are irregular bleeding or spotting. Menstrual disturbances can occur, so this counseling has to be done whenever postcoital pill is administered. So one may not know when the next period is coming, and there may be irregular periods also. And there can be delay in menstruation, so patient should not think that she is pregnant and use other measures of contraception. So now coming to the injectable hormonal contraception. So many women, like we have seen, find it difficult to take oral pills regularly, leading to failure. So many women are not able to abide by that daily intake of tablets. Like we have seen increased failure rate in a typical users, and those who are very compliant. So that's why injectable hormones were developed. So this is a better option in developing countries, but however, it has not become that popular in India. So it can be either in the form of injectable progestogens or combined injectables which contain both estrogen and progesterone. So the commonly used progesterone preparations in India is depot-methoxyprogesterone acetate. It comes under the National Family Welfare Program. It's being used, 150 milligram injection, and norethistone enanthate. So the benefits of this thing is there is the ease of administration, and one need not be injecting it daily. Like norethistone acetate to be injected two monthly, and DMPA is to be administered at 3 monthly intervals, and it has got high efficacy. So mode of action, like any other hormone preparation, it acts by inhibiting ovulation, making the cervical thick and scanty so that sperm cannot penetrate, and also causes endometrial atrophy, rendering it less suited for implantation. So depot injections of progesterone, it is like DMPA is administered in a microcrystalline aqueous solution. Usually 150 milligram is administered every 3 months, or other method is 300 milligram 6 monthly, but Government of India follows 150 milligram every 3 months. Norethistone enanthate is administered in a castor oil solution, 200 milligram 2 monthly. Both of them are administered deep intramuscularly. Nowadays, another subcutaneous preparation of DMPA is available. Lesser dose, and it is more effective. Only 104 milligram the dose is sufficient, and to be administered 3 monthly. So after stopping this depot injections of progesterone, the contraceptive effect of DMPA lasts longer than that of norethistone enanthate. So when do we start this DMPA? During different phases of a woman's life. If the woman has having menstrual cycle, it can be started any time after exclusion of the pregnancy. Preferably should be started during the first 7 days of menstrual cycle. And if she is bleeding, no backup is needed. So if there is any doubt that patient is not in the safe period, then the backup contraception will be required initially. In breastfeeding, it can be administered as early as 6 weeks after childbirth. And if she is not breastfeeding, it can be administered immediately or any time within the first 3 weeks after childbirth. One need not wait for administration of this injectable DMPA. After abortion also, it can be administered immediately after abortion. So what are the beneficial effects of injectable contraceptive? The general beneficial effects: it is convenient to use, does not interfere with sex, there is no reduction of effectiveness with the use of other drugs, no interference with lactation, and there are no coagulation disturbance with injectable contraceptives. The gynecological benefits include reduction in the menstrual blood loss and relieves dysmenorrhea. It is a treatment in cases of endometriosis and endometrial hyperplasia, and that's why it's a prevention. It can be used as a prevention for endometrial cancer. There is a reduced risk of pelvic inflammatory disease. Side effects include changes of the menstrual pattern and irregular bleeding. This is very worrisome to the woman. That's why many women don't continue it for a long time. And then that's why the patient has to be counseled properly regarding this problem. There can be weight gain because of the progesterone. There's a delay in return of fertility. So if the DMPA is stopped, it takes almost 9 months for the fertility to resume. And after 18 months, about 90% of women would have conceived. There is a reduction in the bone mineral density, which causes a reversible osteoporosis. So that's why it may not be beneficial to use it for a prolonged period. So that's why if it has to be used for a prolonged period, some add-back therapy has to be used for osteoporosis. So injectable hormone contraceptive once a month injection, it's a combined estrogen progesterone preparation. not available in India. This is also given deep intramuscularly and it has a low failure rate than the injectable progesterones, and certain side effects like menstrual disturbances are ameliorated with the use of this. So various preparation, some examples using mesigina, norethistérone, 50 mg with estradiol valerate 5 mg. Lunal is quite popular, which is 25 mg DNPA with estradiol cypionate 5 mg. Femiman, and Marvelon, third generation progesterone are being used in this along with the ethinyl estradiol. So that finishes hormonal contraception, oral and injectable. So let us have certain MCQs to see whether you people have understood the subject or not. The first question in this is, what is dipomedroxyprogesterone, which we have dealt just now. So what is dipomedroxyprogesterone? Is it an oral progesterone? Is it an injectable progesterone, a combined oral contraceptive, or combined estrogen and progesterone injection? I repeat, oral progesterone, B, injectable progesterone, C, combined oral contraceptive, or combined estrogen and progesterone injection. The second question, which of the following is the second generation progesterone used in combined oral contraceptive pill? And it is very commonly used nowadays. So the choices are drospirenone, norethindrone, levonorgestrel, desogestrel. I repeat, drospirenone, norethindrone, levonorgestrel, desogestrel. Third question, a woman who is taking a combined oral contraceptive pill forgets to take one hormonal pill. She has been regular otherwise, but now she has forgotten to take one hormonal pill. Which of the following would be the most appropriate action? One need not take any action. B, backup contraception to be taken for 2 days. The woman should take the missed pill at once and continue the rest as per the schedule. Or D, backup contraception to be taken for 7 days. I repeat the choices. No action to be taken. Backup contraception to be taken for 2 days. She should take the missed pill at once and continue the rest as per the schedule. And backup contraception to be taken for 7 days. The fourth question, which of the following hormone is usually used for emergency contraception? A, levonorgestrel, B, mestranol, C, norethistérone acetate, or drospirenone. Levonorgestrel, mestranol, norethistérone acetate, or drospirenone. The fifth question, which of the following statement is true about progestin only pill? A, it has to be started from 16th day of the menstrual period. B, it's a combination of estrogen and progesterone. C, it is more effective than combined contraceptive pill. D, it has to be taken daily without a gap. Thank you.